Hello students, today we can see another topic that's one of the important function of management, that is fundamentals of staffing. So as you know, if the right kind of employees is not employed, there will be wastage of other resources. Man, money, material, machine, methods, these all are the 5M of any organization resources. So if you have not right employees with us, so the other resources are a wastage. So we can see today what are the basic fundamentals of staffing. So the other aspect of human resource management, already I have uploaded videos. Those who have not seen the videos, please see that. Okay. So what do you mean by the staffing? The definition I will give you. Staffing defines as the function by which managers build an organization through recruitment, selection and development of individual as capable employees. It's given by McFarland. There are different definitions are there. I think this is the most suitable one. Here the managers, what they build an organization. Organization is the base. Through organizational recruitment, selection and development of individual as capable employees. Okay. So these all are the components of staffing. I think it's clear. Then we can see the nature of staffing. So staffing is a team centered, that we know that it's not individualized. A group of people are working there, that's why it's a team centered. Then applicable to all types of organization. That means whatever the organization, if in the field of factories or in the field of medical science or in the hospital, wherever it is applicable to that, then it's concerned with all categories of personnel, all categories from the top to bottom of an organization, who all are the positions, all the categories of employees are included there. Then it's essential function of management. That's, we know that organization, planning, organizing, directing, staffing, controlling, coordinating, all the organization, all the functions are included this one. Then essential function of management. Then managers at all levels is engaged in performing the staffing function. Those who are in the top level or those who are in the middle level or in the supervisory level, they are having their own function. Then staffing is a continuous activity. Staffing helps in placing right person at the right job. Okay, it's a continuous process, we will see later. So we are trying to place the suitable person in the position. Then staffing is concerned with the training and development. So here another point, we required human resource, human related skills also. I think it's clear the nature. Then next comes the needs and importance of staffing. Okay. Usual question for the university exam is maybe staffing or maybe the philosophy or maybe any component of that. The important staffing as a critical function of management. We know that it's an important function. Without human resource or staff, the organization will not function. Then second one is helps to build a sound organization, sound human organization. Without that, the organization will not exist. Then staffing ensures maximum output. If you have right person in our organization, so you automatically, our teamwork will be a good one. Then provide job satisfaction to the employees. So that's, if I have right person in right place and we are giving right development, everything, so they have the job satisfaction. Then staffing reduces stress. Proper staffing technique or process we are utilizing, that will reduce the stress among the employees. Then helps in reducing absenteeism and turnover. That we know that if we have it right and properly maintaining the staffing process, we can reduce the absenteeism and turnover of the employees. Then provide benefit to the consumers. That's another thing. Then prepare for future challenges. Through development and training, we can do it. I think it's clear the importance. Then we can see the philosophy of staffing, that's important. So the nurse administrators believe that it is possible to match employees' competency to patient care needs in a manner that optimize job satisfaction and care quality. That means we need competent staff to give competent care to the patient. Then job satisfaction and high quality care. Second one, the professional nurse required to carry out the technical and humanistic care need of critically ill patients. So there we need special skill from the part of the nursing personnel. Then a professional and a technical nurse can provide health teaching and fulfill the rehabilitation needs of chronically ill patients. We have different categories of patients, so we have to give care accordingly. Then use patient assessment, workload, job analysis to determine the number of personnel in each categories of patient. So this staffing pattern, we are assessing a variety of methods are there to assess the nurse-patient ratio. Then the nursing head and staff of the hospital develop a master staffing pattern and policies. The nurse administrator is preparing, with the help of assistant, she is preparing the master rotation plan and the policies for the nursing personnel. Then accommodate the unit workload and workflow by calculating the staffing plan details such as the rotation plan, shift duty, that means the duty roster, what we call it, or scheduling, to be prepared according to the need of each unit. I think the philosophy is clear. Then we can see the important aspect of staffing, that is the staffing process. What are the steps in the staffing process or the components of staffing process? Manpower planning, job analysis, recruitment, selection, placement, induction and orientation, training and development, remuneration, performance appraisal and promotion and transfer. So I have already prepared different videos and uploaded on different aspect of these elements. Okay, so you can go through that. Recruitment, selection, placement, induction, training and performance appraisal, promotion and transfer. Please go through that. Then the first one is the manpower planning. Briefly I will discuss if any question asked as a short note. So this is the first step. It is concerned with determining the number of staff and the type of nursing personnel for according to our type of hospital. Second, job analysis. That means finalizing the job specification and job description. Then only we can move on to the recruitment and selection policies. Third one is the recruitment, as you know, that identification of sources of nursing manpower available, and we are making sure that we are attracting the candidates or applicants for that post. Then selection, we know that choosing the appointing right candidate for the job in the nursing through selection. Then placement ensures the right staff in placed under the unit, that means with the quality. Then induction and orientation is new employees to the organization and they are informed about the working hours, procedures, policies, safety precautions, everything. Then training and development, that means to keep update with the knowledge and skill of the staff, we are giving that. Then remuneration is the compensation, monetary compensation to the employees for their work performance. Performance appraisal is the evaluation of the employees of their work for the promotion purpose or for the better quality care provider as a, or maybe for the monetary benefit. Then promotion and transfer, it's a non-monetary incentive, maybe it's combined. Okay, shifted from a shifted to a higher post with the demanding better responsibility and a higher responsibility. So these all are the elements of staffing. I think it's clear. 10 elements are there or 10 steps are there. You just learn that. Okay, it's important. Then comes the factors affecting the staffing of nursing service. As we all know that the type of hospital, okay, what type of hospital it is, that may be one of the important factor. It is a education hospital, or maybe it's a teaching hospital or general hospital or super speciality hospital. On the basis of that we need the staff. Then second one is the budget, bed strength of the hospital. That means it's one of the important thing is that we have the bed strength. The number of patients under care represent the major work assignment of the nurses. That means estimating the number of staff nurses. Then patient's dependency on nursing care. That means acutely ill patient or chronically ill or moderately ill, mildly ill, on the based on that we are classifying or categorizing the patient's needs. Then type of nursing service, that staff pattern, that may be based on the type of service. So we have to carefully evaluate the patient's needs, and we need more time, okay, for giving the care. Okay. Then comes the standard of care. We know that hospital policies and the standard of care reflect the kind and amount of nursing care. So after establishing the rules, the administrator's responsibility is to make sure that their service is provided as per planned. Then personnel policies, that's another important thing. The recruitment, retention, and personal policy, salary, working hours, etc. are there, sick leave hours. These all things are included in the personnel policies. Then budget. Budget, the amount of money available for the personnel, is one of the most definite element of staffing pattern. That's very important. They have to manage the budget of the organization, okay, to carry out the functions of any organization. Then availability of trained staff nurses, that's another thing. Okay, if many hospitals run with the different cadres of staff nurses, so we have to make sure that. Then role and responsibility of the nurses, that means maybe some hospitals the nurses are carrying out non-nursing functions also, so they are spending more time for the documentation or maybe for other tasks like general activities, so they are splitting their time. Then qualification and job specification of the employees, it's very important. Personnel to meet all levels of responsibility, the educational background and specific qualification on that area is very important. Job description. Then comes the workload. How much workload for surgical unit and medical unit, they required more staff. Even shift wise, we know that if theatre day is there, means we have to prepare the patient. That means that we need more employees, more staff nurses to prepare the staff and send to the theatre. For example, I have given. Then method of assignment, that means this type of assignment of the staff, that means functional method or team nursing or maybe a case method. These all are the examples for the method of assignment. Then the layout of the nursing unit, that also influence the staffing patterns. That means if it an open ward means we require less supervision, we can manage it maximum number of patients. But if it is in the RIGS pattern or in the room wise, it's difficult to manage by a single nurse. We need more number of staff, if closed departments. Then availability of supporting staff. If we need some orderlies are helping the staff nurse, so we can concentrate on the nursing duties, and the other non-nursing activities we can delegate to the these subordinates. I think it's clear the factors affecting the staffing pattern or staffing. It's clear. So these all are the points coming under the staffing. I think it's clear. So just go through that. If you have any doubt, that's an important one. Okay, so I am dealing with the fundamentals of staffing here only. The definition, needs, importance, and then features, nature, staffing process, and then comes the staffing factors affecting the staffing in the hospital side. Philosophy also I have discussed. If you have any doubt, you can ask. And its important aspect, that is the third element of management function. Okay students, those who have not subscribed my channel, please subscribe it, and I am uploading all the videos, okay, related to the 4th year BSc nursing, post BSc nursing, and it can be useful for the MSc nursing or for any exams. If you are preparing for any PSC or NCLEX or whatever it is, you can utilize it and share to your friends also. Okay students, thank you. Bye. It's given by Shanti Xavier.